And now I would like to announce the next speaker. This is Dr. Sandra Holt from Läkemedelsverket.
Good afternoon. In the middle of lunch coma still, right? I'm here representing the Medical Products Agency, and I have been working at the agency for 7 years by now. Today I will speak about registered homeopathic medicinal products, why we do it and how we do it. I will start off by showing you a number of questions and misunderstandings that we frequently find ourselves answering at the agency. I will use them as a basis for the lecture. First one, why does the Medical Products Agency register homeopathic medicinal products? This is directed at us at most of the times. If you think that homeopathic remedies lack effect, why are you withdrawing so many products? Can you relate to these questions? What's the harm? They're so diluted anyway. From this morning, we know that that's not always the case. I will go a bit more into that. And also, why is Sweden so different from the rest of Europe? Do you find these relevant questions? Yeah? I hope I can answer them all, if I have enough time. Let's start with the first one. Why does the Medical Products Agency register homeopathic medicinal products? And the easy answer to that, it's in the law. And the law in question is called the Medicinal Products Act, Läkemedelslagen. I cannot find this one in English, so these translations are my own. If you want the exact phrasing, you have to go into the law or ask me after the lecture. The first paragraph of this law says, the term medicinal product refers to any substance or combination of substances presented as having properties for treating or preventing disease in human beings or animals. So this applies to the situation where a homeopath meets a patient and wants to improve its health, the patient's health, treat or prevent the disease. So all homeopathic medicinal products are considered medicinal products according to this act. In the fifth paragraph, a medicinal product, as defined in the first paragraph, may be marketed only after marketing authorization or registration has been issued. And later in the same law, it says that marketing authorization or registration is issued by the Medical Products Agency. So this is the why. But what is the Medical Products Agency? And especially after the last lecture, I find this relevant to explain to you. What do we do when we register homeopathic medicinal products is the next issue. But first of all, what is the Medical Products Agency? So we're an authority under the Ministry of Social Affairs, Socialdepartementet, and I have to emphasize that we're a separate authority from the National Food Agency, Livsmedelsverket. It's a different authority. They handle foods, we handle medicines. And food supplements is Livsmedelsverket. Socialdepartementet, we're under the Ministry of Social Affairs. This means that the ministry is our boss. Every year they tell us how to prioritize in the tasks, if we have to make changes to the way we work, and so on. If we have new functions that need to be introduced, they're our boss. We're located in Uppsala. This is one of our buildings. Currently we reside in 4 buildings because we are about 780 employees. So it's quite a big authority. And what do we do? Our tasks cover laws and rules of the entire life cycle of a medicinal product, through the development and market entrance, through the use, and also towards withdrawal, the death of the product, if you so will. But our main task is to review and assess applications from companies to introduce new medicinal products on the market. So a manufacturer that has a product he wants to introduce sends an application to the Medical Products Agency. We assess the application. If we find it adequate, in accordance with Swedish law and regulations, we approve, and the product may be put on the market and sold. Medicinal product in this case covers conventional medicines like Alvedon, for example, but also herbal medicinal products, natural remedies, and of course homeopathic medicinal products. We make sure that laws and rules are followed by all companies manufacturing medicinal products. The next question. If you think that homeopathic remedies lack effect, why are you withdrawing so many products? This question has two sides to it from my point of view. First of all, do the Medical Products Agency really think that homeopathic remedies lack effect? And to answer that, you have to know a little bit more of what we do when we assess applications. I have shortened Medical Products Agency to MPA here. We look for homeopathic medicinal products on the safety of the product, more or less toxicity, I will show you more. We look at the pharmaceutical quality of the product. We look into homeopathic use, and that covers both the development and tradition of the product to make sure that it's really a homeopathic remedy. We also look into the product information, more or less the information on the label. This is what we see, what we look at. This is described in directives and laws. We don't look at the effect at all for homeopathic remedies today. So in order to do our job, to make sure that the laws are followed, we don't have to have an opinion. We don't have to take sides in this debate. There's no need for us to say whether it works or not. That's not our task. So we're focusing, trying to be neutral in the middle of the debate. The second part of the question, why are you withdrawing so many products then? It's still a fact. Under our assessments, a lot of products disappear from the market. The simple answer is that they don't fulfill the demands of the law, but to be frank, a lot of products disappear that not on our initiative. They disappear anyway. So often, during assessments, the companies withdraw the applications, and we don't have the reasons for those decisions from the companies. In some instances, we know that bigger companies have withdrawn from the Swedish market because it's too small. And that's not a case that is unique for homeopathy, for homeopathic remedies. This is something that we see a trend for all medicines. That Sweden is a small market. Leaving that question, we will go into safety a bit through the question, what's the harm? They're so diluted anyway. Dilution, as you know, is what many people remember from homeopathy. We have all heard the sayings that homeopathic remedies are nothing but water and so on. I will show you again, you saw it a little bit this morning, I will show you again that not all homeopathic medicinal products are as diluted as the reputation says. But first of all, how low potencies are allowed in Sweden? May a remedy be how concentrated may it be? Let's look at what the law says again. The same law as previously, and still my own translations. If you want the details, contact me afterwards or look into the law yourself. The homeopathic medicinal product may not contain more than 1 part per 10,000 of the mother tincture. So what does that mean? 1 part per 10,000 of the mother tincture. This will be a little bit simplified, but just to give you an idea of it. 10,000 times diluted. 10,000 is 10 to the 4. If you use a decimal scale, you end up with a D4 or a DH4 or X4, depending on how you denote this degree of dilution. If you use the centesimal scale, you end up on a C2. If you speak my language and talk amounts and concentrations, no more than 0.1 milligram raw material per gram finished product. So D4 or a comparable concentration, that's what's allowed, what's legal in Sweden. And this limit is in the law. Does that mean that everything is safe in D4? You know as well as I do that several of the raw materials used are poisonous. Some remedies are really potent toxins. We have arsenic, mercury, digitalis, opium. You don't want to give those to a patient in concentrated form. We also have another example, strychninum nitricum, strychnine nitrate, which has actually proven lethal in pigs at a concentration at a dose corresponding to the use of a D4. Lethal, that's deadly in a D4. So not everything is safe in D4, and my job is to make sure that it's diluted enough to be safe for the patient. Not all remedies are poisons, of course. We also have wheat and artichokes, table salt, baker's yeast. Then there's no issue with the safety as it comes to toxicity. But in each application, the manufacturer has to prove to us that the product is diluted enough to be safe. The overall safety of the product doesn't regard only the toxicity, but also the quality of the product. And by that, we move on to quality. We'll have a quick look at what good quality means. Note that the top question is still the same. What's the harm? They're so diluted anyway. When it comes to quality, we are often faced with the same question on dilution. Why do quality need to be proven for the raw material when you're diluting before you go to the finished product? Same issue here. They're not always that diluted. If you dilute to a D4 and you have contaminations, for example, I will go into detail more. I'm going ahead of schedule here. Quality, when I talk about quality, I mean the pharmaceutical quality, and it covers the manufacturing process from raw material through stocks and intermediates into the finished product. It also covers stability, packaging material, manufacturing sites, and so on. Why is this important then? Two reasons. First of all, it regards the safety of the user. Second, we also address the interests of the user. I will show you what I mean. First of all, it has to be safe for the user also here. The big thing we look at in an application on quality is that the manufacturer follow good manufacturing practice, or GMP. GMP is a set of rules that make sure that the manufacturer has the finished product and the patient in his mind all through the process of making a homeopathic medicinal product. We also make sure that there are no errors in mixture or dilution. Is the correct raw material used? For example, if the raw material is animal tissue, it's not that easy to see the difference between tissue from a pig or the same part from a calf. It's not always obvious. Or who picked the flowers that you're using? Do they have enough botanical knowledge to differentiate between two similar looking plants? Is there a risk for contaminations, either from the raw materials through pesticides, heavy metals, through the extraction phases with methanol, for example? Is there a risk for toxins from moldy plants? Could there be bacteria from handling, and so on? Is there a risk for microbiological growth? If you have bacteria somewhere in your line, it doesn't matter if you dilute the product. If the bacteria are alive, they will divide and still be in the finished product. And is there a risk for mix-up? For example, if you have produced a perfectly good product all the way through the finished product, you pack it in perfect bottles, and then you put the wrong label on it because you forgot to change the label in the machines from the last batch you made. Then you have a useless product. It's a perfectly good product within the can, but the wrong label. So good routines and common sense take you a long way, but without experience, it's not always easy to imagine all the things that can go wrong. Do you see any of these issues resolving if you dilute? From the top question, they're so diluted anyway. Of course, contaminations may be less dangerous when you dilute. But the other issues are really concerns the next question more, that they can affect the quality of the product through the user doesn't get what he's expecting. We have a couple of issues here also that we look at. For example, that the remedy is developed by homeopathic principles, that homeopathic methods are used, well-described methods, that the potency or degree of dilution is denoted correctly, and that the user can rely on the information on the label. If the label says Arnica montana D30, you should be able to rely on that information, right? You should know that the right plant is used and not something that just looks like it. You should be able to rely on that the correct potentization to D30 has been used has been done in accordance with well-described homeopathic principles. You should feel safe that the product has not been produced from poorly handled starting materials, molding plants, and so on, and that the product will be stable until the date on the label, that an ointment doesn't separate, and so on. And these issues aren't really affected by the dilution either. You can't solve these issues by diluting further. So all in all, by recommending registered homeopathic medicinal products to your patient, you give them safe products of good quality. On the market today, we have 1,159 product groups, registered homeopathic medicinal product groups. A product group is either a combination product where you have several raw materials in fixed dilutions in one product, or it's a dilution series where you have Arnica montana D6, Arnica montana D12, Arnica montana D30. You just register the lowest potency, and the entire group is called a product group. These products cover about 550 remedies. Apart from that, of course, all other products, homeopathic products on the market, are illegal homeopathic products. If you want to differ between them, go to our website, where we have lists of all registered products. Out here you can find the search way, click hälso- och sjukvården and homeopathic remedies, homeopatiska läkemedel. This information, you find a lot of information on the English sites also, but not the lists. The lists can be found only on the Swedish pages. So these lists, click them and up comes a list on all the registered products. Out here we have listed all companies that have registered homeopathic medicinal products in Sweden. All other homeopathic remedies not sold from these are illegal. So 5 minutes for the last issue then. Why is Sweden so different from the rest of Europe? To address this question properly, I think we first have to summarize what is different in Sweden. And this is my view, the issues I face more or less daily. I know that you have other issues that differ between Sweden and the rest of Europe, but covering my area, I know medical doctors in general are not familiar with homeopathy, and also the medical doctors that are familiar with homeopathy may end up in difficulties with the authorities, as we heard Rune talk about earlier. There are no educational requirements for practitioners of homeopathy. Pharmacies in general don't carry homeopathic medicinal products, and only simplified registration is possible for homeopathic medicinal products. Simplified registration where you have no indication on the product, you're not allowed to tell what it's used for, but this is because the manufacturer aren't required to send in clinical studies. But then when you don't show clinical studies, you can't claim an indication. None of these are unique for Sweden. The situations in different countries is very different. Some are in the complete other side of each of these questions, and some of them share a few of these with us, but don't understand the other ones. So this is cultural differences that we can see in different member states within the EU. And when the Commission, let's go to again, why is Sweden so different then? When the EU Commission issues a new EU directive, it should be implemented in each country by national law. And based in the differences that we saw on the last slide, is there a risk that EU directives are implemented in national law under cultural impact? Historically, yes, absolutely. And it has been so. Our national laws differ a lot, despite the fact that the EU directives are the same. And there is a need for harmonization, and this is not only for homeopathic medicinal products. For many years, ongoing work is done in a huge number of working groups, working parties, committees, and other formations within the EU. They all work hard to come to a point where an application for registration or marketing authorization of a medicinal product should be treated the same way, irrespective of what country the application is submitted to. And when it comes to the interpretation of EU directive concerning homeopathic medicinal products, The group is called Homeopathic Medicinal Products Working Group. I have added the website address in case you want to know more about this group. And I have listed a few examples of recent issues. First, safe dilution, so that we have the same opinion in all member states on when is a remedy not toxic anymore. Viral safety, if you have virus contaminations, or if you even have a raw material based on virus, how do you handle the safety of that product? Homeopathic use, concerning the making sure that the product is a really homeopathic remedy. And also veterinary products. With that, I want to thank you for your attention, giving you the email address for the Medical Products Agency. If you want to email me directly, do so at this address and put my name in the subject or somewhere in the text, and they will forward it to me. More information can be found on www.läkemedelsverket.se. And never hesitate to contact us in these issues. We are available for discussions and seminars and lectures if you wish. I would also like to say that I left 2 different information leaflets on the table by the door. I know some of you found them on the way in. That's perfect. One of the leaflets regards homeopathic medicinal products, and the other one regards how you differ between herbals, natural remedies, homeopathics, and other related products that you can find in self-care. They are in Swedish, unfortunately, but for most of you, I think that's perfect. Thank you.
Thank you. Thank you, Sandra. That's all right with good laws and safety, but it's not good when I, as a homeopath in Sweden, cannot work illegally. Every day I break the law in my practice because you showed 550 remedies, but I'm a classical homeopath. I have about 200. And there is no homeopathic pharmacy that will bring in new remedies in Sweden because it costs too much. So we have a dilemma. Safety is good. And the homeopathic pharmacies here, they do not survive. So this is a good way of killing off homeopathy in Sweden. So I hope that change will come. Thank you.
Let me first say that I also hope so, of course. It would be very desirable that more companies were interested in marketing their products in Sweden. Absolutely, I agree. No.
May I just want to say also, I've visited the homeopathic pharmacies for many years. I have visited homeopathic pharmacies for many years. And 10 years ago, when I visited homeopathic pharmacies, it was full of life, dilutions, and there was loads happening. Now, the company can only hold a D2. If they want to make a D200 or C200, they have to start from D2. And yes, only allowed to keep for low dilutions if they're going to keep them for a longer time. And they are not, in some cases, it has been difficult for them to use the Korsakoff machine, making high dilutions. So therefore, in Sweden, we face another dilemma. Many times you cannot get dilutions over, potencies over 200. So I buy remedies from abroad, which also is illegal. So make me legal in this country. Yes.
I wish I could. I truly wish I could. And the issues you're talking about, I can't go into details on specific companies because I can't reveal what went wrong, so to speak. Yeah. But I know what companies you're referring to, though. But the fact that keeping only D2, that has to do with showing that what you keep on your shelf is actually stable over the time. So, of course, when you dilute it, it's harder to show that an intermediate of D12 or D30 is still stable, is still the same thing after a couple of years. But if the company shows us stability studies on the intermediate, it's allowed to keep that also. So it's up to the company to keep the quality of the products all the way through the storage also.
Thank you for an interesting talk. I just wanted to comment, but I'm a member of the British Regulatory Committee. We have something called the ABRHP, the Advisory Board on the Registration of Homeopathic Products. So this is the part of the advisory board to the MHR and the medicines and, anyway, the British regulatory body. And much of what you say is familiar. We operate in the same EU framework. But there's, I think, two important differences, I would say, between the UK model and what you're doing in Sweden. And one is the very existence of this committee called the Advisory Board on the Registration of Homeopathic Products. So this is composed mostly of experts on homeopathy. They can be conventional pharmacologists, but they are a profession, but include homeopaths such as myself. It's an advisory board that advises the government, the MHRA, the regulators on these matters. I think it plays a useful role. It has been in existence now for 15 years, long time, soon after the EU regulations took force in the mid-1990s. The other thing is that we also, in the last 3 or 4 years, have a route whereby products can be put on market with claims for efficacy based on traditional use. And this is the case also in most other European countries. Yeah. Or it is certainly
not
in France
most
and
others.
France, well,
but in several
France
others.
and Germany, for instance.
Several others, yes.
France, Germany, Italy, Spain. Major European countries do it. And the UK has recently started to do it, and we are involved in advising on that. So that, I think, is an important, it gives consumers an important freedom.
Absolutely. I agree. When homeopathy in Sweden became a medicinal product, they were considered foodstuff before that. So we don't have an old law, a tradition that is written in law to base such an exemption on. There is an opportunity within the EU directive to keep or to implement national laws regarding these, with indications where you can use more concentrated, lower dilutions and so on. This has not been regarded in Sweden so far.
Okay, I have a question about how much does it cost to registrate one homeopathic remedy? Is that every year a new fee, or who is ordering that it costs so much?
I don't know for sure who's behind the cost. Malin, can you help me out with that one?
It's the government who decides.
The government decides what it should cost. The cost for a homeopathic remedy is very small. I think it used to be 2,000. I think it's 4,000 per product at this moment. But the big cost for the company is not the application fee or the annual fee. It's a small, even smaller annual fee after that. But this is not the big cost for the companies. It's all the documentation you have to round up for each product. So that is the main cost for the companies. Thank you.